Hi, I'm Jamie Spitali, and I am doing my PowerPoint presentation. Um, on the question of is Plavix and aspirin effective together as a dual antiplatelet therapy for patients status post heart catheterization or percutaneous intervention, which is often used for patients that have heart attacks that where you go in through the groin or you can go in one of the radial arteries and be able to get to the heart and open up the occlusion and place a stent. So I want to talk about the risk and the benefits of using a dual antiplatelet therapy. Many studies out there would suggest that you can use one or the other. Some would say both. But anyway, it's said that adding both combined to a patient that is a status post heart catheterization with stent placement will reduce the risk of recurrence of restenosis of that particular artery. The safety of Plavix has been exhaustively researched. As you can Google any scholarly articles on it, you will see that there are tons of them. The ones that I have found have had mixed reviews, but overall it appears to be safe. But there are risks associated with that. Now, aspirin is the most widely taken medication on earth. It was said that over 20% of the world takes aspirin in some form or fashion on a daily basis. Now, is this due to the marketing of the makers of aspirin? That is left to be determined. But there is some positive use when using aspirin to prevent any type of a cardiovascular in patients that are a little more prone to having those that have hyperlipidemia, diabetes, any of the comorbidities associated with a heart attack or a stroke. Now, there is one study in particular that a good portion of most of the studies out there reference. It's called the Charisma study, CHARISMA, and it gives revealing info on its effectiveness when using aspirin and Plavix together. So before we go into the results of the study, we should probably discuss the two antiplatelet medications that are in question. Plavix is an antiplatelet medication usually given to patients who have had a recent cardiac stent placement. But one thing about Plavix is that it has a higher recurrence rate as compared to other medications on the market. So to me, that would suggest that there are better medications on the market, but yet Plavix still continuously is prescribed as the standard medication. There is not one specific test to test if the patient is therapeutic and at decreased risk of restenosis. So this is also one of the problems with Plavix is you are unable to test if the patient has been hypercoagulated to prevent a restenosis of the artery that has been stented. So let's talk about good old aspirin. Aspirin is used as a preventative medication for both strokes and heart attacks, as I had mentioned earlier. I'd also mention that it's the most widely used medication on the planet. One thing about aspirin is that it is a vital part of the ACLS protocol, MONA, which is for morphine, oxygen, nitroaspirin. This is part of the protocol that we do on just about every patient that comes into the ER where we highly suspect that they are at risk of having an acute myocardial infarction. The usual dose of aspirin for preventative measures is usually 81 milligrams a day. But as time goes on, there are some physicians who will do 325 a day. Some patients can't tolerate it, so they have the enteric-coated aspirin that's available to be eased on the stomach. But during a cardiovascular event, such as a heart attack, 161 to 324 is to be given by mouth, preferably chewable, so it gets faster and can possibly help prevent the blockage in the heart from gaining size and creating more damage. Now we need to discuss the benefits of the dual antiplatelet therapy versus the risks. Now there is a benefit. So it was noticed by Dr. Bott in the Charisma study that while there was a decrease in restenosis, it was only slight at best. But the risk, as he also states, is that you're unable to monitor levels. You have a markedly increased risk of intracranial bleeding that can be spontaneous or secondary to a fall, or you can have an increase in bleeding from the GI tract. Worst case scenario is death. You can have a huge hemorrhagic stroke and bleed out within your brain, and we all know how that goes. And in the ER, whenever we have a patient that falls, we always ask if they're on like anticoagulation medication, or we use blood thinners as a layman's term. And whenever they are on some type of an antiplatelet, anticoagulant medication, and they have hit their head during the fall, we immediately take them to the CT scanner to rule out a hemorrhagic stroke or a subarachnoid hemorrhage, or among any of the other names that are used for head bleeds. All right, let's talk about some of the research out there. Briefly, most of all the current data presented refers to two different studies. There's the CARES and the Charisma study. The CARES study is a little more favorable towards the use of the dual antiplatelet therapy, but then you have to also look at who funded that study and what their motives were behind it. And then you have the Charisma study, which if you look, every physician in there has done research for some major pharmaceutical companies. And you had Dr. Bott, who was the lead in the Charisma study, was paid specifically by the two major companies that held the patent on Plavix for a good probably 10 to 12 years. And the study was also funded completely by the two major companies that were marketing the Plavix thing. But with all that being said, both are rather large studies with a huge sample population, which the larger the sample population, the more confidence you can have that the data found is accurate and able to be used in practice on a daily basis. But one of the caveats is that the Charisma study that was funded by two major pharmaceutical companies suggests that the use of both is not recommended and should be used sparingly and with an ongoing follow-up and evaluation with the physician to ensure that the patient is not having any issues or any side effects or at a higher risk for restenosis of that artery. So in conclusion to the brief PowerPoint presentation, the use of Plavix and aspirin together must be used with caution. The risk for bleeding increased and the mortality rate of patients taking both increases drastically. Doctors prescribing these two medications to patients should perform what's called a platelet function test to determine if this will even be effective for this particular patient. Such a simple test that is often under ordered simply due to because they just give the medication and because it has a high percent of efficacy, they decide that it's for everybody. But in reality, it's not. There is a marginal decrease in restenosis status post heart cath, but there is status post heart cath, but there is a significant increase in bleeding and mortality. So to me, this really seems like a dangerous practice when there's so many more other medications on the market today that have a lower risk for bleeding and that have a higher increase in the avoidance of restenosis of the artery. They even have stents they're putting out that are called drug-eluting stents that also work great with other anticoagulation platelets as well. This is the end of my presentation, and I look forward to your responses.